All right, and good afternoon. I'd like to welcome and introduce Dr. Robert Murphy, Executive Director of the Robert J. Havey, MD, Institute for Global Health, and the John Philip Bair Professor of Infectious Diseases here at Northwestern Steinberg School of Medicine, who answers your COVID questions and addresses the latest COVID news every Tuesday and Thursday here on the Havey Institute for Global Health's Facebook page. And today, Dr. Murphy will be answering viewer-submitted questions and addressing the latest news through today, the 28th of October. And we invite you to continue to submit your questions to us via Facebook at NU Institute for Global Health or by email at globalhealthinstitute@northwestern.edu. And leading the discussion today is Sophie Biskowski, our research student assistant with the Institute. So Sophie, I now turn it over to you.
Thank you, Kristen. Hi, Dr. Murphy.
Hi, good morning.
So in the United States, 57.9% of the population is fully vaccinated. Yesterday, there were 87,358 positive COVID cases marked, while the 7-day average is 70,000, and there is a steady decline over the last 14 days. There was still a minor spike yesterday in cases. Hospitalizations and deaths are both decreasing for the last 14 days, but we are seeing a small spike in numerous states such as Maine, Colorado, Idaho, Utah, New Mexico, and South Dakota, and a more major spike in Colorado. In Illinois, 56% of the population is fully vaccinated, and there's a steady decline of 12% of positive cases over the last 14 days in Illinois. What can you tell us about this sort of increase in cases in the last couple of days in the United States?
Well, it tells you one thing, that we are not controlling the pandemic as well as we could be. It's great to see that nationally the numbers are going down, but there's little fires still going on around the country. Colorado right now is doing the worst. We've got these other states you mentioned, have slight upticks, but in general, they're all coming down, primarily because the big states that got really hit hard, like Florida and Texas, huge states. I mean, they've run their course with this wave, and so they're bringing all the numbers down. So that's good nationwide, and it's great that these places that had so many cases is coming down, but it's not over, and so we have to be diligent and take regions one at a time. In a particular region, if the cases start going up, they've got to put in some more mandates for masks and social distancing and limitation on gatherings until those numbers start going down again, which they will.
Yeah, and hopefully with, as the FDA is approving this panel of Pfizer vaccines for ages 5 to 11, that starts to decrease. So what can you tell us about this exciting news that happened on Tuesday?
Well, this is great. It was expected. The review is complete with the FDA. It now goes to the CDC, who meets within a week of the FDA typically, and the CDC will put its little stamp of approval on it and advise and how this is supposed to be done. The states and cities, many of the territories already have been planning for this, and so they're getting ready to vaccinate lots of children. This is for the Pfizer vaccine, and it's a low dose, 10 micrograms. The adult dose is 30. For kids 5 to 11 years of age, it's been found to be very safe. And this is going to take care of somewhere in the 28 to 30 million children are now eligible for this. And this is really going to help in the pandemic, because another big group, especially a group like this that goes to school, can be vaccinated, and they can lower the transmission rate even more. So this is a big step forward.
Definitely. And now the CDC is saying that the immunocompromised individuals may need to get a 4th shot. Can you tell us about this 4th shot that the CDC is now saying that individuals might need to receive?
Yeah, no, this is based on the science that severely immunocompromised patients with underlying hematologic malignancies on high dose steroids, organ transplant patients, really severely immunocompromised patients, they don't make, it's difficult for them to make the protective antibodies. And it's been known for months, and that's why they approved in August the 3rd shot. The 3rd shot to boost their immunity, and it turned out that worked. It works pretty well. It's still not 100%, but it's definitely better than 2 shots. So this is different from a booster. So, they take the first 2 shots and then they take a 3rd shot, and the 3rd shot actually gets them somewhat protected. But they're still not up kind of to the normal range. And what the CDC is saying here, that these people may need a 4th booster. And they're saying take it 6 months after the 3rd shot that they had. And that's likely to be approved at the beginning of 2022. So that would be 6 months after people have taken this booster that just got approved. So that's why it's going to be in the beginning, in early 2022. But it's a good idea. And so, but this is going to be specifically for those severely immunocompromised patients. It's not going to be for the general public as of this time anyway. They're going to see what happens with this booster shot, if this is really going to keep the numbers down. The reason why it's important, and we really got to be careful, is that this AY4 variant from the United Kingdom is increasing significantly in the UK, and there are cases now reported in the United States and on continental Europe, and it is more transmissible. And so, the vaccines still work, but it's worse than Delta. It is Delta. It's a Delta plus, sort of, so to speak. So we've got to get the vaccination rates up now, so that thing doesn't take hold like the Delta had taken hold. So right now we're going in the right direction, and let's hope we stay that way. But we've got to push these vaccines and get these kids vaccinated, so we don't have another big wave like this last 4th wave, or depending how you count. Some people are now calling it the 5th wave. So the 5th wave or 4th wave, whatever, but this wave that's ending right now.
Yeah, definitely. And now for some questions from the public.
Mm-hmm.
These individuals would like to attend a Thanksgiving event, and they would like to know if they should take an at-home test the morning of the event. The thing is that they are mixing individuals that are vaccinated and unvaccinated. Is it safe if they take a test the morning of the Thanksgiving event?
Let's get something straight now about these indoor gatherings. It's not safe to mix unvaccinated and vaccinated people. Vaccines are available. Everyone can get vaccinated. We have to stop intermingling those groups, because the disease rate is so much higher in the unvaccinated. It's just not safe. Doing all these tests is not going to help. The rapid tests have 10 to 20%, miss 10 to 20% of the cases. And so if you have an unvaccinated person, even with a negative rapid test, the chances that they're infected actually the risk is not worth taking. Now, let's assume everybody's vaccinated. Okay, that lowers the risk completely, significantly, not completely, but significantly. And getting those people together, vaccinated people together, but from different households or different states, whatever, doing the rapid test, if it's just for one day, probably one test in the morning would be fine, or when they arrive, or it should be before they arrive. And if it's for a weekend gathering, they should test themselves twice, 36 to 48 hours after the first time. Those 2 rapid tests that far apart actually are as good as 1 PCR test, they say. So that would be the way to go. And that's what we're advising now, people that are having events, weddings, and other gatherings that are indoors now. Everyone's vaccinated, and everyone gets tested before and during the event if it goes more than 2 days.
Right. Yeah, absolutely. And now this individual would like to understand that if they're taking an NSAID anti-inflammatory drug while getting the COVID-19 vaccine, will this reduce the effectiveness of the vaccine? And how far in advance of the vaccine would you recommend stopping the anti-inflammatory drug?
Yeah. So this is a very important question for people with chronic arthritis. And I would refer you to the Arthritis Foundation website. And I think it's just arthritis.org. It's the American Arthritis Foundation that runs it. They've looked at this very closely. So meloxicam is a non-steroidal anti-inflammatory drug. It's very commonly used in arthritis. It has been shown in the laboratory that it may have some inhibitory effects, if that's what it is. It inhibits inflammation. So some anti-inflammatory effects that maybe potentially could impact the effect of the vaccine. However, clinically, none of that has panned out. Clinically, there's no difference. So there's really, you don't have to stop it or anything for in that category of drug. Now, there are other anti-inflammatory drugs beside the nonsteroidals that may be different. And I would refer you to the Arthritis Foundation website, and they go over all the different drugs and what you can do about that. The other thing is that these people, if they're on those, not the non-steroidals, but non-steroidal anti-inflammatories, but the other drugs, some of the other drugs, they may be considered high risk for a third shot. So they may have to, some of them may have to take a third shot, depending on what medicines they're on.
Yeah, definitely.
Mhm.
And for our last question, these individuals would like to attend a birthday party with 10 people in their household and 2 children are unvaccinated, but all adults are vaccinated.
Yeah.
What
Yeah,
should
this is-
we do with the 2 children unvaccinated?
Yeah, this is very common because the kids aren't eligible to take the vaccine yet. So the thing with the kids is the safest way to protect the children and the people there is to have everybody around them vaccinated. Their teachers, anyone they come in contact with, babysitters, and all the family members. The kids don't transmit that much to the adults. That has been shown several times. And so it's basically safe to have them around if everybody around them is vaccinated. And so that's basically the guidelines that exist today. So that doesn't include any unvaccinated people.
Yeah, definitely. Well, Dr. Murphy, those were all of our questions for today. Thank you so much.
Okay. See you next week.